We've talked a lot about otoplasty, the different techniques that we employ, complications, recovery. I think one of the other questions that occasionally comes up, not as frequently, is can my ear actually be made smaller? Can you actually make the size itself smaller?
And most patients that we see for otoplasty have a normally sized ear. They're just not happy with the shape. So the ear itself is protrusive, it comes out, it sticks forward, it's rounding in the wrong spots. Those patients can be treated really beautifully and with great success with ear pinning. The other question is patients occasionally have ears that are just too big in size also. They're large, they're tall, and they want to reduce the actual size of the cartilage itself. That can be done, but it's a much more complicated question. And we really have a very long discussion during consultation with patients about the trade-off that has to do with that, the benefits and risks of doing it, because I'll let you get into the techniques that are used to do that.
Yeah, we'll cut it short in the answer being that most often we will try to talk you out of that. It's not a procedure that, when you look at cosmetic procedures, elective procedures, you really want the benefits to far outweigh and overpass any potential risk and complications. And when you talk about not just sort of bending cartilage into the proper shape, but really taking out a wedge of cartilage in any shape or form to try to bring the ear back together in a smaller routine, there's a lot of risk in terms of deformity, things just going wrong, where we don't typically recommend that.
Yeah, so to just make it clear, to make the ear itself smaller, you actually have to remove a piece of skin and cartilage very often, and then bring the edges together and actually reduce the size. There are various techniques that have been developed for this, largely from reconstructive basis for patients who had cancer or for some reason had to have a portion of the ear removed and then have the ear tried to be made normal again. And for cancer patients, the threshold for success, we would say, is much, much lower. They're very happy to come out of that episode feeling like, okay, I have a passable looking ear that's whole and that I can go out and see people socially and not be worried that they're staring at my ear. For patients who are coming in, on the other hand, from a purely cosmetic basis, where the ear's just a little bit big and they want it smaller, for us, really the threshold for being able to, in a very meaningful way and comfortably, confidently recommend that procedure, I think that's much, much higher.